The basics of breast cancer. Breast cancer is a disease that happens when normal cells in the breast change and grow out of control. Women sometimes discover they have breast cancer because they find a lump in one of their breasts. Breast cancer is much more common in women than in men. But men can get the disease. Breast cancer sometimes runs in families. If you feel a lump in your breast, see your healthcare provider right away. Breast lumps can be caused by conditions that are not cancer. But it is a good idea to have any lumps checked out. Breast cancer is the most common cancer in women in Nigeria and is the leading cause of cancer-related death for women in the country. Delays in diagnosis contribute to the high mortality rate for breast cancer in Nigeria. Is there a test for breast cancer? Yes. Healthcare providers use a special kind of X-ray called a mammogram to check for breast cancer. If a mammogram finds a spot that looks like it could be cancer, healthcare providers usually follow up with another test called a biopsy. During a biopsy, a specialist takes one or more small samples of tissue from the breast. That way, the specialist can look at the cells under a microscope to see if they have cancer. What is breast cancer staging? Cancer staging is a way in which healthcare providers find out how far a cancer has spread. The right treatment for you will depend, in part, on the stage of your cancer. How is breast cancer treated? Most people with breast cancer have one or more of the following treatments. Surgery. Breast cancer is usually treated with surgery to remove the cancer. Many women with breast cancer can choose between mastectomy and breast-conserving therapy, also called lumpectomy. Mastectomy is surgery to remove the whole breast. If you choose this option, you might have to decide whether to have surgery to reconstruct your breast and win. Breast-conserving therapy, lumpectomy, is surgery to remove the cancer and a section of healthy tissue around it. Women who choose this option keep their breasts, but they usually must have radiation therapy after surgery. Radiation therapy. Radiation kills cancer cells. Chemotherapy. Chemotherapy is the term healthcare providers use to describe a group of medicines that kill cancer cells. Some women take these medicines before surgery to shrink the cancer and make it easier to remove. Some women take these medicines after surgery to keep cancer from growing, spreading, or coming back. Hormone therapy. Some forms of breast cancer grow in response to hormones. Your healthcare provider might give you treatments to block hormones or to prevent your body from making certain kinds of hormones that could feed the cancer cells. Targeted therapy. Some medicines work only on cancers that have certain characteristics. Your healthcare provider might test you to see if you have a kind of cancer that would respond to this kind of therapy. What happens after treatment? After treatment, you will need to be checked every so often to see if the cancer comes back. You will have tests, usually including more mammograms. You should also watch for symptoms that could mean the cancer has come back. Examples of these symptoms include new lumps in the breast area, pain in the bones, chest, or stomach, trouble breathing, and headaches. If you start having any new symptoms, mention it to your healthcare provider. What happens if cancer comes back or spreads? That depends on where the cancer is. Most people get hormone therapy or chemotherapy. Some people also have surgery to remove new tumors. Can breast cancer be prevented? Women who are at high risk of getting breast cancer can sometimes take a medicine to help prevent the disease. If you have a strong family history of breast cancer, ask your healthcare provider what you can do to prevent cancer. For example, genetic factors, such as mutations in the BRCA1 and BRCA2 genes, can contribute to the risk of breast cancer. What will my life be like? Many people with breast cancer do very well after treatment. The important thing is to take your medicines as directed and to follow all your healthcare provider's instructions about visits and tests. It's also important to talk to your healthcare provider about any side effects or problems you have during treatment. Getting treated for breast cancer involves making many choices. Besides choosing which surgery to have, you might have to choose which medicines to take and when. Always let your healthcare providers and nurses know how you feel about a treatment. Anytime you are offered a treatment, ask, what are the benefits of this treatment? Is it likely to help me live longer? Will it reduce or prevent symptoms? What are the downsides to this treatment? Are there alternatives to this treatment? What happens if I do not have this treatment? What is the prognosis of breast cancer? The prognosis for breast cancer depends on several factors, including the stage of the cancer, the patient's age, and their general health stage. The 5-year survival rate for breast cancer is 99% for localized cancer, 86% for regional cancer, 31% for distant cancer, and 91% overall. Age. The median age of diagnosis for breast cancer is slightly younger for Black women, 60 years old, than white women, 64 years old. HER2 status. HER2 positive breast cancer is more aggressive than HER2 negative breast cancer, but it responds better to certain treatments. Race and ethnicity. Black women have the highest death rate from breast cancer, while Asian and Pacific Islander women have the lowest. Other factors that may affect prognosis include lifestyle factors and whether the patient has gone through menopause. The overall 5-year relative survival rate for breast cancer is 91.2%, and the 10-year rate is 84%. The 15-year relative survival rate is 80%. MKO Abimbola holds a Dr. Al degree in Physician Associate Studies from the United States of America. He is a Harvard Medical School scholar. He specializes in internal medicine, acute care, emergency medicine, geriatrics, psychiatry, and surgical services. The Basics of Breast Cancer is dedicated to the loving memory of Alhaja Kudirat Iyabode Odewale, a Rhode Islander who dedicated her life to promoting the Islamic faith and Nigerian culture. Though born into a Christian home, she was married to a Muslim and actually became an exemplary Muslim woman, well known, especially for her philanthropic gestures throughout the United States. Unfortunately, she succumbed to the cold hands of death after relentlessly battling breast cancer. May Almighty forgive her and grant her Al-Jannat Firdaus.